welcome to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and we are broadcasting live today from WAGR 1340 AM. We are in the Nelson & Nelson building, and if you join us the fourth Wednesday of each month, we're here at noon, and today we're delighted to speak with two physicians. We have Dr. Jeff Grimm, who is returning to Southeastern after some time away, so welcome.
Thank you, Amanda.
And Dr. Michael Maggitti, and he is a new orthopedic surgeon, brand new to this community and to Southeastern Health, and so we're going to get to know them a little bit throughout this half hour. So we're glad that both of you are here with us. And Dr. Grimm, if you would introduce yourself, give us a little bit about your background, your training, and your time before at Southeastern and now why you've decided to return.
Right. Well, I'm a family practitioner. I've been practicing for almost 25 years now. I had all my training in Charleston, South Carolina, where I went to medical school and did residency training and sort of have a diverse background. After residency, I did emergency medicine for a while and then occupational health with the Department of Homeland Security and the Federal Law Enforcement Training Center, and then came here to practice full service family medicine back in the days whenever doctors took care of their own patients in the hospital. I was privileged to be a part of the hospitalist program at Southeastern and did that for about 10 years as a nocturnist, and then decided that it was time for me to get back to really where my heart is, which is in family practice.
Now, what is a nocturnist for those of us who may not be familiar with that term?
Nocturnists are doctors that sleep during the daytime and work at nighttime.
So that was an interesting schedule, right?
Yeah, it was a constant sleep deprivation cycle.
But we had the program was that there were physicians there all the time, and so you were the nighttime physician looking after the hospitalized patients at Southeastern.
That's right.
Okay.
So now I have returned and am delighted to be at the Grays Creek Clinic. Mm-hmm. Grays Creek has been around, really the clinic opened in 2010, and we were in just a modular building, and now have a state-of-the-art clinic since 2012. Dr. Nas is there, another family practitioner, along with a rheumatologist, Dr. Watson. And so combined, we have close to 50 years of practice experience.
That's great.
The clinic is open Monday through Friday from 8 until 5, and we're able to handle walk-ins. We like appointments. And really, we can do almost everything in the clinic. We have laboratory services, we have radiological services, and we have physical therapy, and we can do rehabilitation on site. We really try to do full service primary care, that's consistent with the mission statement of Southeastern Health. And it's a great place to work, and patients really enjoy the personableness that we have at the clinic.
Great. Just to remind our listeners, we're talking with Dr. Jeff Grimm. He is new to Southeastern Medical Clinic Grays Creek, not new to the Southeastern Health family. And a little bit later in the show, we're going to be talking with Dr. Michael Maggitti, orthopedic surgeon who's affiliated now with Southeastern Orthopedics. So as we continue, tell us, Dr. Grimm, what is family practice? That's your area of specialty, and I'm assuming that's from a young age up through the geriatric folks, the full span.
Right. We take care of folks starting at birth, and see illness not as a problem list, but instead we see illness as part of people. And so our job is to look at what's going on within the context of really relationships. And so we're interested in not just taking care of your arthritis, but also understanding how that impacts your life as well and your relationships. So we focus a lot on wellness, and so we can take care of immunizations and getting folks back to school and sport physicals and camps and all those kinds of things, as well as yearly checkups, making sure that office gynecological procedures are done, like pap smears and mammograms, all those kinds of health and wellness issues.
And I believe that August, which we're knocking on the door of August, is National Immunization Month. And so that's, I would think, an important part for the full span is for kids, adults getting their flu shot, when to know if you need the pneumonia shot, those types of things is an important part of that process with prevention.
Right, absolutely. And of course, things have changed within families over the years. Used to be the typical family was a mom and a dad and 3.3 kids, and now family structure has changed. So in the United States, really, there is no specific family structure anymore. Now there are more single parents with kids, more moms that are struggling by themselves, more divorced couples. We also find that now there are twice as many 60-year-olds as there are 30-year-olds. And a lot of older folks are living alone. And so the needs that people have and the structure of families have changed a lot. And so at Grace Creek Clinic, we want to be there for those folks to give them support, really to be a voice of truth. Folks hear a lot of voices these days in culture. A lot of them are negative. And so we want to be a voice of truth, but we also want to be a voice of hope and encouragement for those folks.
And the family practice physician is really the entryway into the healthcare system. Like, you send referrals to Dr. Maggitti, Southeastern Orthopedic, if you find a patient that has. I've talked to a lot of physicians over the months, and the specialists say, well, start with your family physician and see if you think you have an issue, and they'll refer you out to us. Now, I think Southeastern Orthopedics takes direct patients as well, but the family physician and internal medicine are really sort of the gateway into the larger picture for health. Correct?
That's right, Amanda. We are, family practitioners can take care of about 85% of what comes through the door. However, we're just part of the healthcare team, and so it's a privilege for us to have great folks to be able to send our patients to take care of specialized needs that they have that we can't take care of.
The team collaborative effort.
Right, absolutely.
So at Grace Creek, we have Dr. Nas is there, I believe, one of your peers, and Wanda Faircloth is there maybe once a week.
Right, well,
and you mentioned Dr. Watson for rheumatology, so we have a large group there. People can go there for their physical therapy, rehab as well. So that's a great clinic there, sort of in between Fayetteville and Lumberton, for those folks who maybe live on the outskirts of Lumberton towards St. Paul's, and those folks in Fayetteville.
Yeah, we're right on the edge, and we try to handle as many of the problems that come through the door as we can. We can do urgent care kinds of things, injuries, and decide if more care is needed. But usually we can handle things right in the clinic.
That's great. It's a great resource. And sometimes people get sick and their kids get sick and they need a walk-in. So even though we'd love for people to make appointments from time to time, they can't plan being sick. So we'll see them there as well.
That's right. And we make sure that there's a space in the schedule for walk-ins.
So Southeastern Medical Clinic Grace Creek is located at 1249 Chickenfoot Road in Hope Mills. And the number there is 910-423-1278 if you have heard Dr. Grimm today and you decide you need a checkup, or it might be time for your annual exam or any issues you may be having, you give them a call and schedule an appointment with him. Hello and welcome back to Southeastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and we are broadcasting live from the Nelson & Nelson building on WAGR 1340 AM. And today we are going to continue our program talking with a physician who is new to our community, Dr. Michael Maggitti. He is an orthopedic surgeon and he's practicing now with Southeastern Orthopedics. And if you would like more information about Southeastern Orthopedics, you can go online to seorthopedics.org. That office is located in Southeastern Health Park, 4901 Dawn Drive, Suite 2300 on the second floor there. So, Dr. Maggitti, if you would, tell us a little bit about yourself and how you found Lumberton.
Well, thank you. Basically, my training, I did my undergraduate work at Villanova University. I went to Temple University Medical School in Philadelphia. When I graduated with my Doctor of Medicine, I spent 1 year in a general surgery internship at Temple University, and then moved to New York City and did my orthopedic residency at St. Luke's Roosevelt Hospital Center, which was affiliated with Columbia University. I was there for 4 years, finished my residency in New York City, and then moved back to the suburban Philadelphia area, mainly because of family and familiarity, and began private practice outside of Philadelphia, where I stayed for approximately 26 years. I worked with a group of physicians who came to join me. My practice at that point was primarily joint replacement, shoulder, hip, and knee replacement, arthroscopic knee and shoulder work. And one of the hospitals that I worked at, which was Paoli Memorial, which was part of Mainline Health in Jefferson, which is located in Philadelphia, Jefferson Medical School, was a level 2 trauma center. So basically I took trauma call through the emergency room, which meant that you would take care of people that were injured in accidents, falls. In that area of Chester County, there were some decent highways. There were also activities such as horseback riding and horse racing that brought people in with accidents. So that was something that I did up until 2014. I relocated to North Florida to work with Hospital Corporation of America for the past 3 years in a community hospital. And what brought me to northern Florida, the Jacksonville area, was my daughter and my son-in-law. He's a lieutenant commander in the Navy, and he was stationed at the Naval Air Station. And my son was also down there working. But things have changed. My son-in-law is now assigned to the Pentagon, and my son is first lieutenant in the Marines, and he is stationed in Fort Worth now after spending a couple years in Okinawa. So in essence, not much kept us in North Florida, and my wife is from the northern part of Pennsylvania, so she missed 4 seasons and missed a little change in the temperature. North Florida is fairly consistently hot, so it was an easy call to move further north. But no doubt that I didn't want to go any place where I was going to shovel snow or scrape ice like Pennsylvania. So I told her we were going to find someplace halfway, and this opportunity became available. And I came and interviewed with the other orthopedic surgeons, Dr. Ginna, Dr. Breitbart, Dr. Staley Jackson was there at the time, and Dr. Dalsimer. And the opportunity became available, and so here I am, and looking forward to working in the community, helping out at the hospital, and seeing patients at the Healthplex.
Right. Well, we're delighted that you're here. There definitely is a need for you, so I'm sure you've hit the ground running. So you're at Southeastern Orthopedics, you see patients there, but you also perform surgery at Southeastern Regional Medical Center.
Correct.
And then you also, as we were talking earlier, you take call at the emergency room, so people in the community who may not know about you may encounter you if they've had some type of accident or fracture or something that requires you to treat them through the emergency department.
Yes, that's true. I mean, the emergency room physicians will call, the orthopedic surgeon that's on call. So there's myself and the other members of the group, and I believe Dr. Allen is also on call at Southeast Regional. So in essence, it's you're available during that time for people to come in with emergent problems in the ER. And like over the weekend, there were a total of 4 people who had come in who had broken hips, so they required surgery. And you want to make sure that you treat them appropriately and have the medical doctors available and on board to keep an eye on things when they're in the hospital, and both physical and occupational therapy work with them in the hospital. So that's a little different than when you look at, say, a patient who comes to your office who may have an arthritic hip or an arthritic knee, and you're taking that patient and you're walking them through the process of getting them ready for an operation.
Right.
That is more of an elective procedure versus seeing someone in the ER who didn't really pick
Right.
to break their hip, but it happened,
some accident,
and you need to take care of them. So the relationship that you build with people in the office is much different. I mean, that's something where you want to meet the patient, you want to meet the patient's family, you want to develop a level of confidence in your care, and have them be on board with the options that they have available to treat them. Because again, not everyone needs surgery. Everyone may have surgery ultimately, but there are things that are done non-surgically to help these patients. So I am an orthopedic surgeon, but not every patient that I see in my office is going to end up with an operation. I mean, there are things in terms of conservative measures, whether it's medication, whether it's injection, whether it's physical therapy, bracing. There's a number of things that can be done sometimes in the early phases of these conditions that will allow people to be able to be functional and hopefully decrease pain and be able to do what they want to do. Ultimately, they may require surgery, and when you reach that point, you have that relationship with the patient. They've gained confidence in your care and in the facility, and they understand what their obligations are. I tell my patients basically that, yes, I do the surgery, but I can't have a successful procedure without your help. I mean, physician and patient work together to obtain a good result. So they need to understand what their obligations are, both preoperatively and postoperatively, in order to get a good result. And that's what that whole process is in the office, is educating patients to understand that there's things that they need to do so that everything goes well. I tell my patients that I try to stack the cards on our side of the table the best we can. There's some things that we can't control, but the things that we can, you want to try to control because they decrease potential risks, potential complications, potential problems, and hopefully allow them to have clear sailing after surgery.
And patients access you through a couple of different ways. We talked about the emergency department, which is not really a choice, but then physicians like Dr. Grimm that we spoke to earlier may have a patient who has an issue and it's something that needs a specialist, so they'll refer them to you. But then they can also refer themselves, I believe, in some situations.
Correct. Now, being new to North Carolina, I'm not specifically sure about different insurers. Certain insurers require a referral from the primary. If that's not the case, many patients can just call the office and schedule an appointment to be seen for hip pain, shoulder pain, knee pain. Dr. Dalsimer is an upper extremity surgeon, so he does a lot of hand and wrist and elbow conditions. Dr. Breitbart is a sports medicine physician, so I know he's involved with the university out in Pembroke and does a fair amount of sports medicine. And Dr. Jenna is primarily a joint replacement surgeon who's been doing that for many years.
And so if any of our listeners are interested or hear this, they can call 738-1065, and those folks can guide them through the process as whether or not their situation would require that referral or not, but also to find out about appointment availability and that sort of thing, insurance coverage. That number is 738-1065. So I understand that you do total joint replacement?
Yes.
And so tell us what that means and when that's necessary.
Well, basically, joint replacement, whether it's shoulder replacement, hip replacement, or knee replacement, and there's other replacements for other joints. But in essence, it's not to get too technical, but it's a resurfacing of the joint in question. So if your knee is arthritic, what the surgery does is actually replace the areas that have been worn away. The cartilage is no longer there, the bone is exposed, and as a result of that, that's what causes pain and swelling. Now, the bone has a lot of nerve endings in, and that's what makes it painful. When you have cartilage covering the end of a bone in a joint, cartilage has very little nerve supply. So in essence, as long as you have that cartilage base on either side of the joint, then typically you're not going to have pain associated with the joint unless there's some ligamentous problem, say like a sports injury that may have occurred, caused some damage to your cruciate ligament or medial collateral ligament or something like that. But in essence, the operation covers those damaged areas of bone to give you a non-painful surface to walk on.
Okay.
Whether it's your hip, which is a ball and socket, your knee is primarily a hinge joint, so what you're doing is you're resurfacing the end of the femur, which is the thigh bone, and the upper end of the tibia, which is the shin bone, and also the kneecap or the patella. So those areas get covered with metal and plastic so that you have a weight-bearing surface that will be relatively non-painful. But I tell people that an artificial joint is not what God gave you. So in essence, what you're trying to do with a hip, knee replacement, shoulder replacement is you're trying to make a bad situation better. So in essence, you have to have proper expectations for an operation. Having your hip or your knee replaced doesn't mean you're 25 again. It doesn't mean you go out and you play basketball. Yes, you could probably shoot foul shots and you could pass the ball to your grandson, but the point being is you don't play in a game, because in essence what you have to do is you have to respect the joint in question. It's artificial, so it doesn't act like a live cartilage, live bone. It's made to, again, give you relatively pain relief so that your activity level can improve. But you have to respect it and do the things to protect it so that it lasts as long as it can. The plastic that's used primarily in the hip or knee and in the shoulder, I tell people, think about the tires on your car. If you're driving 5,000 miles a year, those tires are going to last you 5 years. I mean, if you're driving 30,000 miles a year, you're only going to get a couple years out of those tires. So in essence, if you treat your knees or your hip with some respect, then they're going to last you longer. But if you're harder on them, that rate limiting step, which is the poly or plastic, will eventually wear and can cause some issues associated with looseness, because again you're losing thickness of the poly, and then you may have some swelling and you may have some pain. And then ultimately what that may lead to is another operation to revise your implant, whether it's a hip or a knee. The shoulder, a little different because your shoulder is a non-weight-bearing joint. Unfortunately, we make our shoulders weight-bearing, whether we go to the gym and lift weights or whether we go to work and lift bales. We have a tendency of making our shoulders weight-bearing joints, which causes them to wear out a little sooner than we would anticipate. But typically they're not as much of an issue associated with wear, as long as, again, you respect what's there. And that's where the whole patient education comes in, when you have them in the office before you operate. That's not something that you teach someone after. They need to understand that before they go through surgery so they know what to anticipate and what's expected.
What typically causes the need for a replacement? Just overuse?
Most of the time what you'll see is just age-related wear and tear. And that could be very different. I mean, there's genetics components to that, there's activity components. So sometimes you may see a 60-year-old who will come in who has a really ugly looking knee, and then you may see an 80-year-old come in who's only got a little bit of arthritis. Trauma could do it. Prior knee ligament injuries as a teenager or a young adult will cause problems with what is described as post-traumatic arthritis. If you have a fracture into your knee joint, say from a motorcycle accident or a fall, that could precipitate deterioration a little sooner than you would expect, say, from just normal wear and tear. So there's other reasons. And then, again, there's that whole gamut, and Dr. Grimm was talking about the rheumatologist that's in his office. I mean, there's a number of rheumatologic diseases that are many times classified as inflammatory arthropathies. Again, not to get too technical, but things that the rheumatologist would treat that actually cause destruction of joints, because it's almost like your body's attacking itself. And that's why many of the newer medications that the rheumatologists are using are kind of like almost like anti-neoplastic, or almost like things that you would use to treat cancer patients. So you're trying to stop your body from destroying itself. So there are a number of things that can cause the joint to wear. Infection is another. Sometimes people may get a knee infection. Up north, I used to see a lot of people with Lyme disease because it was endemic in that area of Pennsylvania and New Jersey and New York. Down here, probably not as much, but again, I know it could still happen. So you have to have clinical suspicion for some of these things when you do see people.
You talked about setting your patients up for success, having those conversations way before surgery. How important is rehab after surgery?
Well, I tell patients that the fact is that I could show you an x-ray after an operation and it would look great. But if you don't do what you need to do in rehab, then you're not going to get the result that we both expect. Now, you have to be realistic with rehab because, unfortunately, not everyone who goes to rehab needs to turn in Arnold Schwarzenegger. The whole idea is if you have an 80-year-old that they don't need to pump iron. They just need to work on gait training, balance, flexibility, and light strengthening. So that's where the therapist comes in. The therapist tailors programs based upon the patient, their age, their abilities, and also some of the comorbidities they may be dealing with. Someone who has cardiac disease, somebody who has pulmonary issues, they might not be able to do some of the rehab because they might get short of breath. They may develop some difficulties, in terms of mild chest pain. So in essence, you have to really tailor your rehab to the individual to make sure that they get that result. So it's not cookie cutter. It's not one size fits all.
And Southeastern Health has made it so that rehab is accessible to a lot of folks that need it where they need it. It's like in your building, Carolina Complete is in your facility.
Yes.
At Southeastern
Yeah,
Health
I
Park.
believe they're on the third floor where the neurosurgeons are. And one other thing, the surgery center's in the first floor of the building. So there are things that ultimately I'll be able to do in terms of like arthroscopy in the surgery center, as well as at the hospital itself, because they have the same equipment.
Right, and that's super convenient for the patients.
And I'm looking forward to the new ORs that they're going to construct that I believe are going to be hopefully finished by March. So that'll be really exciting.
Very nice for our surgeons, for sure. So we've been talking today with Dr. Michael Maggitti. Thank you for joining us today. He is with Southeastern Orthopedics. If you would like more information, you can go to seorthopedics.org or call 910-738-1065. And his office is located at Southeastern Health Park on Dawn Drive in Lumberton. And earlier today, we were talking with Dr. Jeff Grimm. He's with Southeastern Medical Clinic, Grace Creek. And the number to that office is 910-423-1278. Thank you for joining us for Southeastern Health's Healthy Connection.